Thank you, Kathy. Good afternoon and welcome to the Monday, December 20th, 2021 Health and Human Services Committee meeting. This will be the last meeting of the year. It's hard to believe we've made it through another year. I would like to start out by thanking all of the members of the committee for sharing your time with us this year. We have certainly gone through a lot this year, and we have embarked upon COVID. We have embarked upon recovery funds. We have worked with human services agencies in our county, and I think we should be really proud of our accomplishments this year. So thank you for your hard work and your dedication. Let's see here. We do have one change to the agenda. There were some advisory board appointments that were sent out earlier today by Brittany, and I just want to make sure that everyone received those. I have a thumbs up from Amanda. Leslie, Mike, Henry, did you all receive those?
Yes, I got them. This is Mike.
Great.
Yes, I got them too.
Okay, thank you. Okay, and so if I can get a mover to add those to our agenda today.
I'll move her second.
Okay, moved by Mike Sigler, seconded by Amanda. Are there any questions or concerns? I see none. We are going to add those to number 7 under appointments. Kathy, do we have anyone that has signed up for a public comment?
No, we don't, but do you want to take a roll call vote on adding the appointments?
Yeah, that would be a good idea. Amanda Champion. Amanda's nodding yes. So this is to add the advisory board appointments to our agenda today. Leslie Schill.
Yes.
Mike Sigler.
Yes.
Henry Granison.
Yes.
And I am a yes as well.
Yeah, sorry, Shauna, my computer, I'm having technical difficulties, so I don't know what's going on.
Okay, thank you. Okay, that's unanimous. Thank you. And Kathy, do we have public comment? Anyone that
No,
emailed us?
No, we don't, Shauna, thanks.
Okay, thank you. And as far as the chair's report, I am going to keep this pretty short and sweet because I know that we're probably going to have a big COVID report in this HHS meeting, and we have some resolutions. I want to add that in January's meeting, we will be going over the goals that we have set forth for our committee in 2021 and see where we landed for the year. We also can talk about any topics that you all think might be lingering. We will, I'm guessing the meeting will actually be right before we are assigned new committees. So the January meeting will be the last committee meeting that we have based on this group of legislators. And I want to thank Frank Krupa and all of the staff at the Public Health Department. Right now, we have obviously seen a massive increase of the positive cases that we've had since last month's meeting. And I know that they have been working diligently to do the contact tracing, and they did host some booster clinics. We're able to get some kids vaccinated. And we just want to thank their staff for continuing to support our community. I did send lunch to the community services or the community nurses today in appreciation from the legislature. And certainly that's the least we can do. We realize that they're exhausted, and we just continue to thank them for their hard work and their dedication.
Shauna?
Yes.
Excuse me, I don't know if you were done or not, but I just want to, I think your meeting in January may fall on a holiday.
Oh, well, we will have to reschedule then. And I will send out a we could do a doodle poll and we'll figure that out and send out a notice to everyone, depending on what everyone's schedule is for January. So yeah, that makes sense. It's probably Martin Luther King Day would be my guess. That just so happens to always be my birthday too. So I always get my birthday off. So let's move on to the county administrator's report. Lisa Holmes.
Hi, thanks, Shauna. As you've alluded to, and as you can imagine, we're doing a lot in a lot of different directions with the increased activity in COVID, and as reflected in the two resolutions you have before you. And I don't want to at all steal Frank's thunder, but I know that the health department has been working on all cylinders with the vaccination clinics, the booster clinic, the 5 through 11-year-olds, as well as the case investigations, and now with last week with the governor's mask mandate, the enforcement aspect of that. So a lot going on there, you know, just doing a lot to serve our community, as you mentioned. So the two resolutions that you have before you are related to all of those things. That's pretty much what I've got in terms of my update.
Okay. Before we move to the resolutions, Lisa, can you tell us, is the EOC back in form and operational right now, or where are we at with that?
Yeah, the EOC essentially never stopped working, but moved to more of a virtual format. So everyone is in close communication, but via Zoom, phone call, text, and so yes, and we have been meeting and communicating more regularly. It's kind of deja vu all over again with the new with the Omicron variant and the mandates coming from the state and so forth. So yes.
Okay, thank you. Are there any questions for Lisa? Okay. And we do have two resolutions here. First resolution, continuation of COVID-19 testing contract with Cayuga Health System, ID 10596. If I can have someone move, please. Moved by Leslie. If I can have a seconder, seconded by Amanda Champion. And Lisa or Frank, would you like to speak to this resolution?
Yeah, so this just continues the county's contract with CHS for the first quarter of 2022, providing for free community testing as well as supporting our municipal, mandatory testing versus vaccination program for county employees as well as other municipalities. So it looks like we will need to continue that for at least the foreseeable future for the next quarter.
And are there any questions for Lisa about this resolution? Amanda?
Well, just, oh, it does say the date, right? At the very end. Through April 1st, 2022?
Yeah.
Okay, sorry, I missed that, but that's what I needed to know. Thanks.
Sure.
Lisa, has the cost of those tests decreased or is it staying the same?
That is a question I do not know the answer to. I think it would be the same. I mean, Amy, Frank, there you go. Do you know the answer to that?
Yeah, it's still the same.
Yeah, thanks.
Okay, any other questions about this resolution? I see none. Let's do a roll call. Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler,
Yes.
Henry Granison,
Yes.
and I am a yes as well. That's unanimous. Thank you very much. Another resolution, appropriation from contingent fund and contract with Human Services Coalition for continued 211 COVID-19 response, ID 10610. If I could have a mover, please. Moved by Leslie, seconded by Amanda. And Lisa, if you could speak to this, please.
Sure. So the Human Services Coalition and 211 have been a very strong community partner throughout COVID, providing a central call-in location for people to get COVID information, register for clinics, and also most recently, a place to point to for questions or to lodge a complaint about the mask mandate. So we've put up a portal on the health department's website where they can do so electronically, or if they don't have access to a computer, they can call 211 and they can receive that assistance through 211. And again, given the activity around COVID-19, we do see the need for this in the foreseeable future. So this would enable those services to continue in 2022.
Thank you, Lisa. Any questions for Lisa? Leslie?
For Lisa and Frank, do we think that either of these new extended costs might be federally or state reimbursable down the line?
We certainly will keeping our eye out for all of that and trying to maximize the FEMA reimbursement wherever possible. But I don't know that Amy and Jess Furfus at the Department of Emergency Response are in the weeds on submitting for FEMA reimbursement. So we do maximize everywhere we can. I can say that much.
And Lisa, do you happen to know, FEMA is reimbursing us a portion of our testing expenses. How far in arrears are they?
That's Amy's going to be joining us in a little bit. She may have more up-to-date information on that. I'll have to check in with her.
Okay.
Sure. They are behind. I mean, it's coming slowly but surely, but they are behind.
Okay, let's go ahead and vote on this resolution if we have no other questions. Roll call. Amanda Champion,
Yes.
Leslie Shield,
Yes.
Mike Sigler,
Yes.
Henry Granison,
Yes.
and I am a yes as well. Thank you. Frank, is there, would you be able to give us a mini update as to what is going on with our numbers, and yeah, just an update would be great.
Sure. And obviously we're planning our usual report for the full legislature for tomorrow evening. So there'll be more detail there. Obviously everybody's aware that case numbers have gone up. It's been primarily fueled by higher education students and what we believe is the Omicron variant. I'll start by saying we're extremely fortunate that we know anything about the variants. If it wasn't for the work, the partnership between Cuyahoga Health Systems and Cornell to be able to do both the screening and then the subsequent sequencing of the test results, we wouldn't have this information. And I would suggest that while our numbers have gone up pretty dramatically, and we're talking about Omicron, and it almost seems like we're an outlier in the state and across the country, I don't think we're an outlier, other than that our infrastructure for testing and sequencing is better. And so I think much of the rest of the country is probably experiencing similar things, just not knowing it yet. Case numbers have gone up. We've been working very closely with Cornell, Ithaca College, TC3 to make sure that we're able to get the students the information they need around isolations and quarantine. I will tell you that we do not have the capacity to call every single one of them. So we've been working to create internal communication mechanisms through email and texting to alert them when they test positive. Once we're alerted they've tested positive, to what they need to do in relationship to isolation. Our primary focus has been on community cases. And by community cases, that's anyone that's not between 18 and 24 years of age. right? So we've, because of the volume, we've used that age group to kind of generally identify the higher ed students, understanding there's probably some non-higher ed students that fall into that age range that are cases, but the vast majority of them are higher ed students. Then when we move into the community cases, we further prioritize those people under 18 in an effort to keep children in person in school, and those over 65, because they are more likely to have more severe illness associated with COVID. And we want to make sure that we've contacted them and they're getting daily contacts. So if things get worse, we're able to help advise them if they don't seek healthcare on their own. The good news is using those criteria and focusing on community cases, we're not really that far behind. Generally speaking, I'd say anywhere from 70 to 80% are still getting a call within 24 hours. And then the others are somewhere in the 48-hour to 72-hour range, depending on the volume of cases in any given day. So the team has done an amazing job of trying to keep up under what have been some pretty significant constraints the last week or so. So all that being said, what do we know? We know more than most, but probably not enough to answer a lot of questions yet, right? What we know is Omicron is the predominant variant in the student population. We also know that we've seen some indicators through the testing for Omicron in our community numbers at a much lower rate than the student population, but it's there. So it means it is certainly circulating in the community population. We have some beginning data on the hospitalizations as those numbers have, ticked up over the last week or so. A small sampling of those hospital inpatient folks had the screening test for the S gene dropout conducted, and none of them indicated the dropout, meaning that we are likely dealing with Delta still in our hospitalization folks. So we've kind of got two things going on here. We've got our peak of Delta happening with this new onslaught of Omicron coming into the system. Obviously, it'll take time before we know more about the more recent hospitalizations and if Omicron is playing a role in those, but we'll keep our fingers crossed that that turns out not to be the case. We don't yet know for certain that Omicron is going to be a milder form of the variant. Signs are pointing in that direction, but we just don't know that for certain. And we're kind of monitoring both now, Delta and Omicron, to try to understand what's actually happening for us in our community. On the vaccination front, as Lisa alluded to, we did hold a large booster clinic, I guess it was a weekend ago. We did over 1,100 folks. We did do first dose clinics in Newfield and Lansing this week for the kids. We are going to be taking a 2-week hiatus from vaccinations over the next 2 weeks, just because we don't have staff to be able to manage it at this point with the case numbers and everything going on. So I understand there's a lot of demand, particularly for boosters. I would say the state has opened a location in Binghamton. And my understanding is that there are appointments available this week at that location. So I would encourage folks that have the ability to transport over there to look for those sites, and you can find them on the state's vaccine finder can direct you to those appointments. We are planning another large booster clinic. It's looking like January 8th will be the first day we'll be able to muster the staffing and the vaccine supply to be able to do another. So I'm hoping that folks will be able to find vaccine over the next few weeks as that state site opens, and then we'll be prepared in early January to create another opportunity here locally for folks. And we, of course, will continue to partner with our schools in January to get more children in those clinics taken care of. So that was a lot, but also probably not nearly enough at the same time. So I'll stop there, Shauna, and happy to answer questions.
Great. Thank you, Frank. Leslie?
Thank you, Frank. That was really helpful. And thanks. It was great to see you at the booster clinic the other weekend. Good to be having that opportunity. Couple quick questions. One about hospitalizations as well as those who have passed away from the disease. If we're noticing the prevalence to be among vaccinated or unvaccinated folks, or if there's any information available about that. I know people are concerned, and then recognizing that the new sequencing is revealing Omicron in the student population, and we know that the student population is extraordinarily vaccinated. What is the takeaway for that for the rest of the community? Is there something we should be thinking about? And then lastly, are you providing any recommendations to K-12 as far as this last week of school? I've been hearing from community wondering about going online, or is there going to be any recommendation to step away from mixing for a few days before the holiday? No idea. I know these are all policy decisions that the schools will have to make, but didn't know if if the health department is weighing in at all on that.
Sure. So can you tell me the first question again, Leslie? I'm sorry.
That's okay. I was just wondering about the hospitalizations and the deceased.
Yeah, so
if there's any correlation.
That data is coming. We're compiling it. We'll have it for you all tomorrow night for both hospitalizations and the folks that unfortunately have passed. So the team is working today to bring all that information together. So stay tuned for that. So in the higher ed population, yes, that they are a highly vaccinated population. I'm always hesitant to draw conclusions about a virus based off of our experience in Tompkins County, because the numbers are small, right? The sample size is relatively small. However, in this instance, certainly with Omicron, it does appear that vaccination status isn't having we don't know the level, but certainly it has, we've seen more transmission in fully vaccinated students with Omicron than we have throughout the pandemic, since students have been fully vaccinated. All that being said, there's tens of thousands of students and 2,000 or so have tested positive. So I don't want the message to be that the vaccine doesn't work, right? It could be that we could have 10,000 cases if these students weren't vaccinated, right? It's hard to demonstrate that prevention component of it. But what we do believe and we understand is that the vaccine will help with the severity of illness with the Omicron variant if it is not as effective with transmission as it had been for the others. So always, anytime we're talking about vaccines and their efficacy, they are still the single best tool we have available to us. So we want everyone to be vaccinated and boosted as soon as they are eligible. On the K through 12 front, yes, I talk with the superintendents pretty regularly. Staff talks with the school nurses on a daily basis. It is our goal to keep schools in person. And that is obviously the school's goals as well. We have been having communications about, what the spring, after January, situation will look like. I don't think we have final answers yet. We're still waiting on some clarification from the state on isolation and quarantine directives and what those will look like. What I can tell you is I believe in almost every instance that the schools have gone virtual, it has not been because of the students. It is because unvaccinated adults have to be quarantined, and therefore they're not appropriate or adequate adults available to operate the schools logistically. So while the schools when we talk about the schools being virtual and cases in the students, really the message is if every adult that was eligible was vaccinated, I don't know that we would have had a school go virtual this year. And so that's really the message. Vaccines, particularly for adults, we need you to take that step in order to help us keep the kids in school in person. That's going to have the biggest impact on in-person school for children.
Thank you.
Thank you, Leslie. Henry?
Yes, thank you for the report, Frank. I was curious as to the numbers. I thought that Cornell had closed on Tuesday and that we really wouldn't see the increase in numbers for this weekend. I noticed today went down to 41. Does that mean that most of the Cornell people are gone and that we would not be receiving those high numbers anymore from Cornell?
So just some clarification, Cornell didn't close. They went virtual with their finals and they canceled some events on campus. So the university has been operational throughout and students are still, actually, I think Saturday was the last day of finals, but all through
Right.
last week, students were still participating in their education through Cornell, just virtual. So many of those students are, some of them are year-round residents, right, that may not be leaving. The ones on campus that are not in isolation, I believe, are scheduled to be gone at this point, but there are still quite a few that are in isolation that the university is supporting. So there's a mixture of how many students are still here, probably more than would be on a normal year during the holiday season, but I think there's definitely the transition for folks with holiday travel. So as far as the case numbers, Cornell had an expectation of their students to get tested before they left in an effort not to further spread, what we had here in other places. So students have been testing throughout this week in preparation for their departures. So that has an impact on the continued testing. The 41 tests today are largely in part because the mall site is closed on Saturday. So generally speaking, the numbers we report on Monday are usually significantly lower than what we've seen throughout the previous week. And it's really just a function of when the laboratory is open. We won't know probably for another 4 or 5 days about what the impact on the results are from students departing the area for the holiday break.
Is Cornell still going to surveillance test everybody on campus? Do you know?
I think all of that is in discussion at this point.
Okay, thank you.
Frank, can you talk a little bit about enforcement? I know that there are some stores that we're walking into or restaurants or places in the community where we're seeing 100% compliance. And then there are some places where we're seeing 5%. And I know that there is a website that people can report non-compliance. However, how is our staff supposed to be able to enforce that?
Yeah, thanks, Shauna. We're taking an education approach, as we always do with enforcement. When we start, our environmental health division is monitoring the complaints as they come in. We have been communicating proactively to businesses, providing them signage. I saw quite a few of our signs out and about this weekend. So I think, that's an improvement, right? The sign shifting from you can wear a mask if you want to you must wear a mask. So that was a good sign to see. And then, as we get repeat complaints about particular places, that's where the focused attention will be. It will primarily be reaching out to the business and offering support on how they can come into compliance with the mask mandate. Ultimately there are administrative fines that can be, administered. But I'm hoping, as we have throughout the entire pandemic, that we don't have to go that route, that our community businesses will, heed the guidance and follow the mandates that are in place. But we do have a process to collect that information, and we're going to do the best we can.
Great, thank you. Are there any other questions for Frank? I see no hands. Thank you very much, Frank. Next, moving on to mental health, we have a resolution for authorizing the acceptance of staff recruitment and retention funding, Mental Health Department, ID 10607. And we have Frank Krupa here and Harmony Ayers-Friedlander here from Mental Health. If I could have a mover, please. Moved by Amanda. If I could have a seconder, seconded by Leslie. And Frank or Harmony, would you be able to explain this resolution to us?
Sure. And I want to start by introducing Harmony. I don't know that everybody has met her. Harmony is our Deputy Commissioner and Director of Community Services for the department. I think she may have been to a meeting in the past, but I wanted everyone to get to meet her because she and Jeremy Porter and the other leadership folks at Mental Health have been doing an amazing job. And, while my focus has been other places, and we're just so happy to have Harmony on board, and she's been doing some pretty amazing things in just the short time that she's been here. So I wanted to make sure that you guys were familiar with her as well. But as for the resolution, so the New York State Office for Mental Health, through a governor's initiative, has provided resources for mental health providers for retention and recruitment during these difficult times in healthcare, in retaining and recruiting staff. They're doing it in two ways. One way is a lump sum payment that will come to the department for our clinic, our clinic, which is the larger portion of the work that we do. And they will also be providing a supplement to our payment structure for our PROS program, our personalized recovery oriented services, a smaller program, but another licensed program in the department. And the purpose is for recruitment and retention within the department. So we've been having some internal conversations about how to use those monies for both purposes, recruitment and retention, providing as much recognition for the existing staff that have been with us through the last, just very difficult 2 years, while at the same time, using some of the resources to recruit for the vacancies that I think the community is not, aware that we're dealing with, that's resulted in our limiting intakes for a short period of time. So we're hopeful that the legislature will authorize us to accept these funds and apply them to both existing staff and for recruitment of future staff.
Thank you. Any questions for Frank or Harmony? I don't see hands. Let's go ahead and vote. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler,
Yes.
and I am a yes as well. Thank you. Frank, I know that there was a press release that went out last week in regards to the mental health department and accepting new intakes. And I was wondering if either you or Harmony can add some analysis to that.
Sure. So I'll start and let Harmony jump in. We're experiencing a staffing shortage. We've had a couple of retirements. We've had a couple of folks leave. We have a couple of folks out on extended medical leave. And traditionally, when we've lost a clinician, we would absorb that caseload into other clinicians for the short period of time during recruitment. We're unable to do that with so many positions vacant. And as we were just talking about, the healthcare environment for recruiting new folks in is challenging, and so it's taking a little bit longer on top of the volume of staff that have left. So we've made this transition through a lot of effort and thought with our team, with our community partners, about what makes the most sense to move forward. What we don't want to be doing is bringing new people into care that we can't serve. We have community partners that are out there that we would prefer those folks seek another location where they might be, able to get into care quicker. And we want to be able to focus on our existing clients that we've already brought on board. All that being said, we are the safety net provider. And so there are certain things that we will continue to do during this limited shutdown of intakes. That is hospital discharges, people that are in crisis, those that have, severe and persistent mental illness. We will be, continuing to work with those folks and addressing their needs. So I just want to, make everyone know that this was a difficult decision for the clinic. And I will tell you, there are people over in that building that are sick that we've had to do this. But we just couldn't put any more on the shoulders of the folks that we have without further making the problem worse by burning more people out. So it was a difficult decision. We do believe it will be short-lived. We're already interviewing, and hopefully we'll be bringing some more folks on board. And obviously, if we're able to shorten that time frame, we will. But we'll keep the community updated. I did want to let Harmony kind of jump in about some of the things that were considered through the process, and more of the detail about what we will continue to be doing.
Thanks, Frank, and thank you for having me here today. So we have really looked at everyone's caseload and determined what types of services people really need so that we know we're giving people adequate care. There were a number of people that were in the intake process, and we are going to complete that full process with anyone who was in the intake process. We've communicated with the hospital to make sure that they're aware that anyone that's discharged from the hospital will not be impacted by this. We've communicated both with Family and Children's Service and Alcohol and Drug Council around taking other people in during this period of time that they are able to serve, and have a triage intake protocol in place right now, so that we are evaluating anyone who comes in and determining whether or not they need to be seen immediately, or whether or not their services could be either delayed at their own choice or referred to another agency. And we're getting a lot of support from other agencies around this. Everyone's experiencing a workforce crisis. I don't think it's shocking to anyone, and in healthcare in particular, it's been pretty significant. And we've also really looked at some ways to improve our workforce recruitment, expanding the licensures that we accept for our master's level positions, which will open us up to about 50% of the workforce that we haven't recruited before. We've also done a lot to change the work environment to make it more attractive. There's a lot more competition out there now for clinical people who can work 100% virtually, from larger agencies that have moved into our community and across the state. So virtual care has really exploded, and people are finding it very helpful for many, many people. But it also means many other locations that clinicians could work at. So we're trying to make it as creative as possible and a good workplace for people. And we are interviewing right now.
Great, thank you. Any questions for Frank or Harmony? I see no questions. Thank you both. And please thank your staff as well. I hope that we are able to find some good employees. And, I know that we've talked about salaries being competitive. I do hope that whenever we do the salary study that we're able to act upon that and get the salaries where they need to be. So thank you both. Okay, next we have the appointments for our advisory boards. And we have a whole list here. First is the Tompkins County Youth Services Board. Khaki Wunderlich, at-large member. The term expires December 31st, 2024. Second is Patty Van de Bogart, at-large member. Term expires December 31st, 2024. Next, for the Office of Aging is Susan Hatch, at-large representative. Term expires December 31st, 2024. Next, Carolyn Byers, at-large representative. Term expires December 31st, 2024. The Mental Health Community Services Board, Khaki Wunderlich, member. Term expires December 31st, 2025. Dr. Auguste Duplan, member. Term expires December 31st, 2025. Stu Bergman, member. Term expires December 31st, 2025. Mary Hutchins, member. Term expires December 31st, 2025. Substance Abuse Subcommittee, Stu Bergman. Community Services member. Term expires December 31st, 2025. Mental Health Subcommittee, Mary Hutchins. Community Services Board member. Term expires December 31st, 2025. Beth McGee, community member. Term expires December 31st, 2024. And if I could have a mover for these, please. Moved by Amanda Champion, and a seconder, please.
I'll second it.
Seconded by Leslie. And if there are any questions or comments, also if there are Questions and comments that would like to be discussed during executive session, I would like to offer that as well. I see none. Let's go ahead and vote on these advisory board appointments. Roll call, Henry Grannison,
Yes.
Amanda Champion,
Yes.
Leslie Shield,
Yes.
Mike Sigler,
Yes.
and I am a yes. Those are all official and will be moving to the legislature tomorrow. We have some minutes to approve, minutes from November 15th, 2021. If I can have a mover, please. Moved by Leslie, seconded by Amanda. Any questions or comments, corrections? I see none. Let's do a roll call. Henry,
Yes.
Amanda,
Yes.
Leslie,
Yes.
Mike,
Yes.
and I am a yes as well. Are there any comments from committee members or liaison reports? I see none. There are some budget adjustments and transfers that are noted at the bottom of your agenda. Feel free to take a look at those. Are there any comments from our committee or updates from departments? Kate?
Yes, thank you. Good afternoon, everyone. Just a couple things I wanted to make you aware of. On January 27th, 2022, from 1 to 4, we're going to be doing the 2022 United in Kindness Symposium, what to do about cyberbullying. It's going to be virtual. It's going to be featuring Samir Abhinduja, who is the co-director of the Cyberbullying Research Center, and Amanda Verba, the Chief Operations Officer for the Ithaca City School District. Be focused on adults and also school workers at that point. And then later in the afternoon from 7 to 8, we're going to be doing a session specifically directed at youth around the same topics. It's called Tompkins County Youth Speaks Out. It will be moderated by Melanie Little from the Mental Health Association of Tompkins County. So we're excited about that. I emailed Kathy some information. For the youth piece, there is an ongoing poster contest that I do believe is due January 17th. So if you have any youth that would be interested in that, please be sure to reach out to them. And I do believe Kathy forwarded the information, so you should have that at your accessibility. So thank you.
Great, thanks, Kate. Okay, any other updates? JR, hello.
There we go. Hello. Got to find the ever elusive mute button. Yes, I just wanted to share a couple of things just because it's pretty exciting for us. This month we had our Winter Coat Project kickoff, and what this is something we started last year with the Triad Foundation, Jeff True, where these coats that come from Detroit from the empowerment movement, they're coats that are designed for people who are stuck out in the elements, and are big, heavy, oversized coats that fold out. They have a flap inside that folds out to make it a sleeping bag. All Velcro, no metal enclosures, so that people who are stuck out in the elements, particularly our homeless population, can have something to give them some type of shelter or some type of shielding from the elements. Anyway, we did this last year for the first time, and earlier this month we had our distribution with our 3 main police agencies: the Sheriff's Department, the State Police, Ithaca Police, and also a rep from DSS's Adult Protective Services and Family and Children Services. So these are now out there, and they're made for people that they come across who, as I said, are stuck in the elements, or maybe were in an accident when they're not dressed for the elements. It's ironic that as soon as we gave them out the temperature, we started having those 50 and 60 degree days. But the idea is for having this for people when the temperatures are nowhere near that. And we know that State Police gave out their first one last week. The second thing is just I really want to give a nod to Jeff Smith and Dan Pichet, I hope I'm saying his name right, at the Highway Department. This week, I don't know if some of you remember a couple of months ago, Jeff put out a call for help, asking people to donate items for gift boxes for veterans that would go toward veterans in need, particular things like socks, toiletries, self-care things. That organization is called One Soldier at a Time, who this is being donated to. They're out of Rochester. Well, they turned that donation back around to us, provided us 300 gift boxes. And thanks to some suggestions from a couple of our local American Legion posts, we took them out to the VA clinic, and they were very happy. And they started giving them out to some of the veterans who were already there for their assignments. I mean, for their appointments. And I had one of our staff members tell me that she saw a vet walking out with his box going through it while he's going outside. So it's been pretty cool to know that that was happening. We're able to put some things in place and just spirit of collaboration of making things happen. So it's this one-man department is trying to make it look like we're doing a lot of stuff here. So I just wanted to share that good news.
Great news. Thank you, JR.
Thank you.
Questions for JR? I see none. Thank you very much. Have a nice holiday.
Happy holidays, everyone.
Kathy Schlatter from Human Services Coalition.
Hi, I just wanted to let everybody know that we have extended the sign-up period for the Ithaca Guaranteed Income Project. It originally was supposed to sunset Friday at 11:59, and we are extending it for those people. There were quite a number of people who had started their applications, and possibly people who were concerned about it. We've answered some questions for some people, and we've extended that period until tomorrow night, the 21st at 11:59 p.m. So if you live in the city or a caregiver, take a look at it. You can sign up through our website, Human Service Coalition website, or you can Google Ithaca Guaranteed Income Project.
Great, thank you, Kathy.
That's it. Thank you.
Any questions for Kathy? I see none. Thank you very much. Happy holidays.
Same to you all.
Kit Kephart. Hi, Kit. How you doing?
Hi. Good, Shauna. How are you doing?
Good, good.
Good. So I just wanted to give people a couple of quick updates. You're probably going to hear some information coming out about a rental supplement program. OTDA has just announced a new program that they are putting together. We had a briefing on it last week. We're going to be learning more about it this week. It's going to require that DSS submit a plan by mid-February to receive the money and then administer the program. So I don't have a whole lot of information about it yet, but I'll be bringing it back to the committee. It's kind of it's a hopeful thing because I think we're all very concerned about what happens when the eviction moratorium goes away and beyond. And so it's likely this won't be really up and running until spring of 2022. But I think it's something on the horizon that as quickly as the ERAP funds have gone and as much as we continue to want to help people and will with some of the other program funds like ESG, I think this is another thing that is going to be out there that we'll be able to support people with. So no real details right now, but as soon as I have them, I'll be coming back to this group, hopefully next month with a little more information, if not in February. So I just wanted to kind of give people a quick update on that. DSS is chugging along. We are continuing to, I think like everybody, we're continuing to kind of struggle with staff absences. So even though we're fully staffed in most divisions, one of the things that is happening is people are out a lot, either because of kids issues, or they're being tested, or they're positive. And so we're having to constantly manage, people are managing their own caseloads plus, that of others. So it's a stressful environment. People are tired, but I think that's everybody these days. So I think that's all I have right at the moment.
Great, thank you, Kit. Any questions for Kit? Okay, thank you, Kit. Happy holidays.
To you too. Thanks.
Okay, anyone else have any updates for us?
This month we did a couple of programs in human rights. One was a training for tenants that we did with CNY Fair Housing, in which we informed the participants about their tenants' rights and fair housing updates. We talked about source of income and the ERAP program as well, and other matters. We had scheduled a training for landlords, which was to be held on December the 9th, but we had to reschedule that, and we'll be rescheduling that in the new year. On the 9th, on the evening of the 9th, we had a human rights roundtable in recognition of International Human Rights Day, which was actually the 10th. But two colleagues of mine who head up human rights operations in Rockland and Orange County, as well as the incoming commissioner for the New York State Division of Human Rights, were the panelists, in which they highlighted 3 areas of human rights concern that emerged from the work that they do. And so we had about 70 people participate in that discussion on the 9th. Also, too, want to make you aware that we will be going through a transition in leadership for the Human Rights Commission. Gladys Brangman, who has served us very well for the last 2 years in helping to reestablish the commission, will be stepping down, and there will be a vote that will be taken next month in terms of new officers in her replacement. But Gladys did an extraordinary job in helping us navigate the, at times, challenging terrain, I should say, over that first year, in which, but has enabled us to position ourselves in the commission in a much better space than where we were when we began nearly 3 years ago. So her successor will be determined next month when the commission meets again. So we just wanted to make you aware of those things that have been happening over the last month for us.
Great. Thank you, Dr. Clark. Any questions? Okay, I see none. This is our last meeting, obviously, of the year. And again, thank you all for attending and providing feedback and coming to all of these meetings. I wish everyone a happy holiday and stay safe and healthy. Thank you all. Take care.
You too, Shauna. Thank you.
Thanks, Shauna.